Recently, social media has been flooded with news about fitness influencer Prateek Yadav facing a sudden, severe medical crisis. His story grabbed headlines precisely because he seems like the last person who should end up in an emergency room fighting for air. On the outside, an individual might look perfectly healthy, right up until the second they cannot breathe. While sudden chest pain and gasping for air might instantly suggest a heart attack, the underlying mechanics of this specific crisis follow a different biological path. Medical professionals call this specific condition a pulmonary embolism, or PE. A pulmonary embolism happens when a massive, abrupt blockage occurs inside one of the pulmonary arteries, the crucial vessels responsible for carrying blood into your lungs to get oxygenated. This blockage represents the final stage of a silent chain reaction. Although the emergency manifests in the chest, the process begins in a distant part of the body, often days before the first symptom appears. To find ground zero, we have to look far away from the chest, down into the deep veins of the lower legs. What should be a fast, efficient flow of blood back to the heart can sometimes turn into a stagnant, slow-moving river. That stagnation happens when we stop moving, sitting immobilized on a flight, being confined to bed rest, or physical changes during pregnancy can cause blood to pool heavily in the lower extremities. When blood sits still for too long, it begins to coagulate. You can see how red blood cells gradually clump together, forming a solid mass against the inner vein wall. Doctors call this localized buildup deep vein thrombosis, or DVT. At this early stage, the warning signs are subtle and easily brushed off. A person might experience a strange, heavy feeling in one leg, localized swelling, or a dull pain that mimics a simple muscle cramp. Ignoring that mundane ache after a long trip allows a stationary problem to upgrade into a highly mobile, life-threatening projectile. The solid mass breaks free, accelerating upward into the bloodstream. This embolus slips through the heart's right chambers, pumping directly into the narrower pulmonary arteries. It violently wedges into a tight bottleneck, instantly cutting off blood flow and starving the lung tissue of oxygen. The physiological impact on the patient is immediate and severe. They are hit with sudden shortness of breath, a stabbing chest pain, a racing heartbeat, and rapidly plummeting blood pressure. The suddenness of the respiratory attack is the visible conclusion to a much longer timeline. The lung blockage is the final collision of a biological time bomb that began ticking days before the patient felt the first gasp for air. The moment that arterial bottleneck occurs, a very tight window of survival opens. The patient requires immediate emergency intervention before the right side of the heart fails from pushing against a blocked pipe. Standard X-rays might only offer subtle hints, like a raised diaphragm, swollen blood vessels, or fluid buildup around the lungs. These are red flags, but they aren't enough to pinpoint the exact location of the threat. To locate the exact coordinates of the blockage, doctors rely on advanced imaging like CT pulmonary angiography. Looking at this stylized scan, you can trace the bright white branches of the vascular tree until you hit an abrupt, stark dead end. That void is where the embolus is sitting. While the scan confirms the target, the medical team is already running stabilization protocols, pumping the patient with supplemental oxygen to counteract the failing lungs, and pushing IV fluids to prop up crashing blood pressure. The patient experiences the terror of the physical symptoms, while the dedicated medical team uses this methodical imaging to identify the blockage before the clock runs out. Once the patient is stabilized, the counterattack begins. As illustrated in this microscopic diagram, anticoagulant medications like heparin or warfarin are introduced, creating a chemical barrier around the solid clot to actively repel new blood cells and halt its growth. In the most severe, life-threatening cases, doctors escalate to thrombolytic therapy. Here, aggressive chemical agents flood the blockage site to actively corrode and dissolve the existing solid mass, forcing the arterial pathway back open. Surviving a PE requires intensive medical intervention, which makes prevention critical. Travelers aren't the only ones who need to stay hypervigilant. Anyone recovering from orthopedic surgery, dealing with bone fractures, or managing a cancer diagnosis carries a significantly higher risk of clot formation. The defense strategy is straightforward. Mandate movement. Get up and walk during long periods of sitting or bed rest. And if you ever develop unexplainable leg swelling, a heavy cramp, or sudden breathlessness, seek emergency care immediately. Pulmonary embolism is highly lethal, but largely preventable. Understanding the journey a clot takes from the leg to the lung provides the knowledge necessary to interrupt the chain reaction.